thank you so much, Steve, for joining us today.
Yeah, honored to be here.
The Anterior Hip Foundation is a foundation that we developed largely for pushing the benefits of technological advances in surgery and specifics as they relate to hip surgery. A lot of this has to do with development of new technologies, how they get incorporated in the system. You were a recipient of a newer technology procedure a few years ago. You underwent an anterior hip replacement, and you actually got a chance to see a recovery from somebody who underwent a simultaneous bilateral procedure, which is a procedure that commonly wouldn't be performed through standard techniques. Tell me a little bit about your experience as it relates to the hip replacement, the recovery, the surprises you might have found, the difficulties you might have encountered for both you and your wife.
Okay, I mean, all my life I've encountered, older people talking about having had a hip replacement, and they always talk about it very positively. So I just sort of assumed that's kind of one of the things you run into. I'm, not an expert in the field and researcher and all that, but Janet for years had trouble walking, and we'd go to the park and she'd walk 100 feet and sit down on a bench, and I would walk the dogs for a mile. And come back to her, but she wasn't able to walk very well. She was very scared of looking into surgery. I said, maybe you need hip surgery, and she would never listen to that. And finally, one day, we ran into somebody that recommended you yourself, and your type of surgery is the anterior type, and anti is in front, and spoke so highly of it that we went down to see you. She got x-rayed. She needed 2 hip replacements, and I got to watch her in the hospital go through it. So I kind of knew the procedure. I never had any fears. Janet had fears all the way, different personalities. Now, I went in secondarily. As a part of that, I had actually been walking. I do a lot of traveling for speaking. I'm in a lot of airports, and I'm carrying a 50-pound backpack. And my left leg was getting sore and sore, just the leg. And I kind of remember sort of limping into Frankfurt once and going out in just about a wheelchair. So for that month, I had 19 speeches around the world in the month of December of some year. I don't do years. And I was basically had a wheelchair a lot of the time was arranged for me. And that was a horrible mistake, because you're counting on other people that don't even know you to actually come through and deliver the wheelchair. I mean, there was a time I was the last person on an international flight because they forgot about me. And but anyway, so I'm going through that. So I went down when Janet was in your office. I went down. I said, I'd like to be looked at. Give me an x-ray or whatever. Check my hip. Oh yeah, you found that I had the same sort of cartilage wear and all that, and my left hip was due for surgery. I said, let's go ahead. I was all gung-ho. I had a really good attitude, because a lot of people have hip surgery. The more people that have something, the better I feel. That's one of your best things. Also, the fact that we had a really good, strong recommendation to you. You weren't really near our home as much. You were up in San Francisco, but personal recommendations you can never beat. If you trust a person. So the trust was there, and we had confidence. I had a lot of confidence. And you explained very well what was going to happen, what it was going to be like, all the steps. And also you like try and true technology. I said, oh, you're going to use some 3D printed, some special new materials. No. We just do what we know to do, and all the time, and it's safe, not like risky. I had a good attitude. I did a lot of joking that day, saying, oh, can't I get to watch it? And so I said, somebody said, yeah, but you have to have a drape in front of you so you can't see it. Oh, bummer. I wanted to hold the bone saw, I said. And then when I came out of the surgery and woke up, I said, was it a boy or a girl? But no, and walking was really easy. I mean, getting up and going around practice walks and up and down stairs with like crutches. After a couple of days, crunches were in my way. I just used a cane and sort of didn't feel like I needed it for leg feelings, for hip feelings. I used the cane to, I just didn't want to put extra weight on something that was kind of newly assembled. The hip has just been wonderful, just getting around just like normal. Even that night, I could walk up and down the stairs.
That's a big part of what we do. And that's something we really love to do as orthopedic surgeons, is restore that independence. Yes. As far as your early recovery, and did you need a whole lot of support during your recovery? I mean, it was just you and Janet, right? You didn't need like nursing or anybody else in the home to help you through this recovery?
I think Janet had one of her assistants doing a lot to take care of her.
Yeah.
And I would do things like, oh gosh, what was it? We had to pour fluid into something to help with the pain. What?
Yeah. And then as far as getting back to walking the dogs, how soon was it before you guys could get back out and start walking the dogs? How long before you were back out helping those pups?
Well, I don't know. For myself, it feels like it was less than a
About a
week.
week. Yeah, as I recall
And
from our
but I would use a cane at first just to relieve the stress on one leg, but not for hip pain. For a long time before that, Janet often couldn't walk the dogs, and I would get up on my own even at 4 a.m. and walk the dogs. So they didn't really lose out. The dogs are very important. Thanks for what you're doing. I'm glad that Anterior is growing so well. And that's the only thing we recommend to somebody. See, we have a home in Colorado that we're going to move to. When my right hip may go someday, probably will. And when that happens, I'll probably want to fly back to the tried and trusted doctor I had before.
So in conclusion, I really do want to thank you for your time today. I really appreciate it. And I look forward to seeing you and follow up in the future. Thanks for being part of our program.
Great to see and talk to you again.
Take care, Waz. All right. Bye-bye.
Bye.